Good afternoon, everybody. My name is Elena Graziosi, and I'm with Autism New Jersey. And I'd like to thank you for coming today to attend our webinar, The Journey to Community Housing with Supports, a roadmap for individuals and their families in New Jersey. Today, we are grateful to have Deb Wehrlen, who is the principal author of the guide, here to present it to you. And Deb, I will hand it over to you, and thank you for doing this on our behalf.
Oh, thank you. My pleasure to be here. The Housing Guide was funded by the Council for Developmental Disabilities in New Jersey, and we partner with Autism New Jersey in preparing this guide. The Supportive Housing Association of New Jersey is the grantee and has been responsible for this whole project. We have the ability for you to download the guide off of the internet. We encourage you to do that. You may also get a printed copy by calling Autism New Jersey at 800-4-AUTISM. As Elena mentioned, I am the primary author. There were many contributors to this guide, and we have tried to put into one place all of the information that is needed for someone who has a disability and their family to work together to put a plan for themselves for housing. Much of the information included in the guide is specific to New Jersey, although the general information is applicable in all states throughout the United States. What we hope to do in developing this guide is, again, to have all the resource information that is needed for people to understand regulations and the system and how it works. We've provided links to the website so that you can go directly to the website and get firsthand information. We encourage you to do that. We've tried to keep this document up to date, but things do change, and so you want to check primary sources on critical pieces of information. We also interviewed many people who live in very innovative housing types of settings and talked with them about what they liked or did not like about those settings and how they went about preparing their plan for it. And so we have featured these case studies talking about vignettes of people who are living in different housing options, and they're featured as innovative elements of supportive housing throughout the guide. We encourage people to look at this not in terms of a specific model, because each of these models are very much able to be customized to the person who needs the housing and residential supports. But we encourage people to look at these models just for the innovative elements that are there and to see what parts of it might work well in a plan for you as an individual with a disability or for your family member if you're planning for them. And we've provided a lot of information about not only housing models, but funding sources, how you seek and obtain housing in terms of rental housing or mortgages, and also mainstream resources. So there's different sections of the guide that can be referred to. We also try to explain much of the jargon. In New Jersey, there have been some major changes that have happened over the past 2 years. And so we've gone from where things were pretty much models of a specific program where everything was bundled to now where people can kind of pick and choose and customize the types of supports that they want. And it's much more exciting, and it's much more flexible than it was in the past, but that also puts more responsibility on you as the consumer to research and to find things. So we talk in the guide about unbundled services, which would be this idea of things being very individualized, and you could pick and choose from a menu of options. And we talk about individual budgets, because it's no longer a package of one service that you would get from one single provider, although that may be available still, but it's much more individualized, and you get to choose. You also get to interview and select the providers that you might want to be working with. And to the extent that you are able and interested, you're able to direct a lot of your services. So some people want to interview the employees that will be giving them direct support. They may want the ability to hire or fire those people if they're not happy with the services, and those are all options that can be available. Very much so, individuals, and with the support from their families, are controlling their own housing options and services and living very integrated lives within the community where they've grown up. So this section goes on to talk about housing options with innovative elements, and these are some of those models which we have explained in the guide in more detail, and I'll go through a few of them just to highlight some of them. The idea of supportive housing and housing plus these supports is again one of the changes that we have seen happening in the field of developmental disabilities, where again things are unbundled. So you may have one service provider that provides direct support services and someone else perhaps that provides therapies. There may be another vendor that provides transportation, and housing could be separate from those supportive services. You may have a landlord instead of having a service provider or an agency that was in control of your housing in the past. We really advocate that everyone have a safe, decent place to live and receive the services and be as independent and self-sufficient as they're capable of being. So we look at people with developmental disabilities as having a wide range of abilities and needs for supportive services. Some people can live pretty independently with someone checking in with them periodically during the week, and to the other end of the continuum where someone might need 24 hours a day, 7 days a week to have staff available to them. We'd like to see to the fullest extent possible that people live integrated, supported housing, and they live integrated lives within the community, that they have people in their lives who have disabilities and people who do not have disabilities. And the same is true for housing. We'd like to see people live in those kinds of independent lives. And self-directed or individual-directed supports would be where people can make that planning and choose those desired services. In New Jersey, there's a support coordinator who can help you to design and secure those services, working within the individual budget that might be prepared for you. First, I'm going to talk about the models, and then I will go on to talk a bit more about the funding. Shared living is a very exciting concept that has a wide range of support in many states throughout the U.S. This would be where people could live in any kind of housing setting. In fact, of the models I'll describe, most of them can be in any kind of residential setting, being a single-family home, a condominium, an apartment. It could be in rural areas, in urban settings, in the suburbs, and there's just a lot of variety that these models can support. With shared living, a person with a disability really controls the housing and may invite another person with a disability to live with them. They may also interview and have direct support staff that could live within their same housing. So let's say the person has a condominium and they hire someone to give them some supportive services, and that person chooses to move in and share the apartment with them. We feature this in the model, one of the models in the guide, where we talk about Dave, and Dave lives with Todd, and Todd does not have a disability, but they are sharing their household. They share a lot of responsibilities. They do shopping together. They do a lot of recreation, and Todd gives a lot of support to Dave. Dave also has other staff that come and go in the apartment so that Todd gets to take some time off as well. So it's an exciting model called shared living, and there are many services available that can help you to match up with someone who is looking to share their housing, or someone who may need those kinds of supports as well. Sometimes a person has 2 or 3 roommates. We recommend that if you choose this kind of option, that you really spell out all the details of who would be responsible for what. Who's going to pay for the groceries? Will that be shared? What are the rights if somebody's unhappy and wants to move out? And in the guide, we give you a link that will take you to a model lease that could be developed just for this kind of supportive housing. So that's shared living. Support families or host families would be similar to perhaps what might have formerly been called a foster home. The difference with support families or host families is that very often these families have the support of a larger provider agency that can give them training, backup support, respite, bring some additional therapies into the home if that were needed, and give a lot of training and supervision to the host family. So that's an exciting way, and for some people who want to live within a nuclear family, this is something that could work very well. Group homes are a concept that many people are familiar with. They're also known as community residences, and in a community residence or a group home, usually 4 to 6 people live together. There are staff generally 24 hours a day, 7 days a week. Whenever someone is in the home, there's a staff person available to them. Sometimes the residents of the home go out to work during the daytime, and staff then would just be on call as needed. There are also some very intensive specialized group homes, and we're seeing more and more of these as well, where people with serious medical problems or some serious behavioral or psychiatric challenges could still live within the community in a group home setting, and the agency that provides those kinds of supports has a lot of intensive training for staff. They have a lot of backup kinds of professionals who can lend support to the person who needs it within the group home, and also help the staff. So some of these are specialized group homes. You would be researching to find these on the websites for your state. In New Jersey, that would be the New Jersey Division of Developmental Disabilities. The guide gives a lot of resources about assistive technology. And the reason being because more and more we're utilizing within our homes technology to make us safer, to make life more convenient, to operate things remotely. And much of this technology can relate to a person who has a developmental disability and needs support. There are actually some smart group homes. In a smart group home, all this technology is available. So computers operate a lot of things. People work a lot of apps from their cell phones. There's remote monitoring sometimes, where if a person doesn't need a face-to-face staff person all the time, a FaceTime or Skype on the computer could give the person access to a staff member who's on duty and can help in the event of a problem or an emergency. We're hoping that assistive technology may create opportunities for people with disabilities to be even more independent and rely less upon people to provide those supportive services. So we encourage you to look at these kinds of options and start using them. Again, many apps on your cell phone, many of these devices are relatively inexpensive, very affordable. Some can be bought in just your local stores. So we do encourage you to look at how technology can help. And in New Jersey, there is a technology agency that can give you some help in terms of designing this for your individual needs. And there's even a lending library where you can borrow some of the equipment and try it out and see how well it works for you. Safety is another area where people can use call buttons for emergency contacts, where there's gadgets that can be hooked up to your home so that you can see who's at the front door, so that people outside the home can see what's going on when necessary. Encourage you to look at all these kinds of options to help people with disabilities to be more accessible. Most people who have developmental disabilities live at home with their families. And state government is recognizing that it makes sense to help families with more support so that the person with a disability can continue to live within the natural family's home for as long as possible. In New Jersey, there's the supports program, which is providing a lot of these supports to help people to live more independently in their own home or in the home of their families. Intentional communities is a concept that's growing in popularity. Many families and people with disabilities feel a comfort living in a community where other people have the same kind of challenging needs and supports. So intentional communities could be in a lot of different settings. Some are farm communities, some are ranches. There's one exciting one in Minneapolis, which is a guest home, a guest house, and tourists can come there and stay, and people with disabilities can help give them whatever support or services they need while visiting in Minneapolis. There's one member who knows the history of the community very well and can actually provide a walking tour. So intentional communities can provide opportunities for people to live together in a very comfortable setting, to have a strong peer group, and also be able to access services as they need them. One of the difficulties with an intentional community is that the federal government, and in many cases state government, are looking for intentional communities to be less isolated. The institutions of 50 years ago, we are trying to close throughout the country, and the reason being that they were set in rural settings and very isolated for people. The Center for Medicaid and Medicare Services provides funding for these kinds of residential options. I'll talk a little more about that as we go on. They have a lot of concerns and want to be sure that people who live in these settings do not feel isolation, and that they have plenty of access to interact and be in the community and talking and having relationships and friendships with other people who do not have disabilities. So those were the models. Now I'm going to talk a little bit about funding. And again, some of the information I'm providing is specific to New Jersey, but has definite applicability to other places, other states as well. In New Jersey, the Department of Human Services oversees the Division of Developmental Disabilities. Now, this is the leading source of funding for people who have developmental disabilities and are adults looking for housing or residential support. I'm going to talk a little bit about SSI. Eligibility, Social Security is one of the requirements for people to be able to access these kinds of services. And they access those through Medicaid, which comes with their Social Security benefit. I'm going to talk about waivers and the way that those fund a lot of these services, and also state plan services and additional government agencies. So Social Security is very important. If someone is eligible because they have a disability, they may be eligible for SSI, which is the most common way for a person with disabilities to receive a cash supplement each month to be able to pay for their room and board and living expenses. And with that comes their Medicaid, which provides health insurance and also some of these long-term support. Some people also qualify for Social Security through being a disabled adult child, and their parents have Social Security benefits. So in both of those options, and there are many regulations and many specifics about eligibility, sustaining eligibility, and how these programs work. So we encourage you to seek information directly from the Social Security Administration through their website or through a visit to be able to find out how this works for your family member. And I don't have time in this webinar to go through this in great detail, other than to say that Social Security is going to be able to provide much needed cash to pay for living expenses, and the Medicaid is the health insurance and the ability to seek some of the longer term supports that are needed. With Medicaid, the home and community-based services waivers are the way in which the federal government gives money to the states. The state definitely shares in those costs and provides lots of services for people that need them. person has to qualify in New Jersey for services under the New Jersey Division of Developmental Disability and meet their eligibility criteria, which resembles the federal eligibility definition as well. They have to have a disability that occurred before the age of 22. There have to be significant impairments to their ability to live independently. All these things, again, spelled out on the website, and you'll want to look at those. But once the person receives their eligibility from DDD, simultaneously they should be applying and receiving Social Security. And from Social Security, they would have Medicaid. And that's the way in which, again, the state would provide many of the supports that you might be looking for. The idea of waivers is that if the person were not receiving these services in the community, it would require that they live in an institutional setting. And both the federal and state government recognize that it's much more cost-effective and it's a better quality of life for someone to live in the community rather than in an institutional setting. And so the federal government waives the requirements and provides the ability for the money to be spent within a community setting rather than in a nursing home or an institution. So the New Jersey Developmental Disabilities Division of Developmental Disabilities, or DDD, again, is the leading source of this, and eligibility would be access to an intake worker with DDD, and you can find those addresses on the website, which we guide you to in the housing guide. The majority of people with receiving services from DDD live at their home with their families, and DDD does provide more supportive services for them. And people living within community residences or some of the other models that I described, which might have a license, would be paid for through the waiver, the home and community-based waiver. In New Jersey, that's called the community care waiver. That pays for these specific services for people that require them and would otherwise meet an institutional level of care. And that's a key term that people need to understand, so that if they were not getting the supports through this waiver, they would be requiring living in an institution. The support program would be for people that need less intensive supports. Very often, people utilize this to provide daytime activities, either employment or job coaching, volunteer work, day programs, and some people design their own types of activities that they want to provide. And through the supports program, they're able to access staff who can help to take them through these, take them to and help them support them to utilize these activities that they would within the community. So the supports program can provide that. The supports program can also provide people to come into the home and help in terms of daily living skills, personal assistance, dressing, bathing, all those kinds of support needs. And both the community care waiver and the support program, family can access help through a support coordinator. The support coordinator knows of services that are available, providers that are there, and they can help to plan with you how you would access these services and what you would obtain. And MLTSS is a waiver that is not within the Division of Developmental Disabilities. It's in the Office on Aging in New Jersey, and it's for people that have intensive medical needs and want to live independently and not in a nursing home. So those are three different waivers that exist in New Jersey, and people need to look into those. There are guides online that can give you an example of the service providers who are available, as well as the menu of services that could be available. State plan services are another way to augment some of the service delivery that might be needed. And state plan services would be those things which each state individually decides that they will provide as a Medicaid benefit in that state. In New Jersey, that includes dental care, pharmacy services, and some physical therapies, some personal care assistance. Some of these services would be accessed through your managed care organization or an HMO. Those are both the same. HMO or an MCO would be similar terminology for the same entity that would be responsible for assessing your need and approving. Two of the state plan services that not everyone knows about in New Jersey would be the Personal Preference Program and the Personal Assistance Service Program. And in both of these instances, you would work through your MCO, your managed care organization, to get authorization for these services, and they would assess how much you need personal care to help you to be more independent. So they may be able to approve a personal care attendant to come into the home and assist with dressing, bathing, supportive services. There are also additional agencies, and we encourage people to look at these because there may be a person with a dual disability or another handicap who could receive some things that the Commission for the Blind, the Division of the Deaf, the Office on Aging, these are mental health services. These are other state agencies that may have services to offer, and also local and community resources that may have services to offer you if you have another disability or are aging. So when you're, let me recap. So you go through eligibility and you receive your eligibility with DDD, the New Jersey Division of Developmental Disabilities. That means you have Social Security benefits and Medicaid. And you need to sustain those benefits in order to continue to receive some of these supports that we're talking about. You would then go through an assessment process. In New Jersey, that's called the CAT, Comprehensive Assessment Tool. And the CAT is the time where you would describe what really are the needs of the person that's accessing services. Often a family member would be the person to help complete this, and the assessment would give the level of service delivery that would be needed if you, the family, were not able to provide that. So it's the time to be very realistic and very honest about the support needs. Once the CAT is, the CAT assessment tool is completed, the state would then utilize that to determine a tier upon which the level of service delivery is needed. And each tier would give you sort of a range. It guides the state and the support coordinator in terms of a range of funding that could be available in an individual budget. And then with the support coordinator, the individual and their family can design, okay, I need this level of support, I need this kind of service, and so that may be a staff person to come into the home and help the person to get ready in the morning and help them in the evening to cook dinner. And let's say that the person was pretty independent but needed those levels of support. There may also be the need for a daytime and vocational program. There may be some therapies or behavioral supports or medical nursing care. These are all some of the options on a menu of service that you could be designing into the plan. And then the tier would give you the up to amount of funding that would be available to you to access these services. The money does not go directly to you as a person with a disability or you as a family member or guardian. The funding would be the up to number that is utilized for your individual budget, and then you access those services. The service provider then submits a bill to the federal government through Medicaid and would get payment for rendering those services. Now, I want to talk a bit about affordable housing, because when you take your individual budget, the money that comes from DDD through the waiver which would likely be the support program or the community care waiver. Those monies pay for the direct support, and the therapies and those kinds of services, the day program or vocational services, the job coaching, a group home, or supports to come into the home and help the person to be more independent. So that's where the DDD money comes from. The Social Security cash benefit that comes to the individual would be the SSI check in most instances. That Social Security check is going to be utilized to pay for housing, for utilities, for food, for clothing, and recreation. So there's not a lot of money. The budget's going to be very, very tight. The person with a disability is of very low income and may need to seek as many resources as they can to be able to supplement their individual budget and provide all that they need to live independently. And when I say independently, that may also mean living within the family home and being more independent. So let's talk about affordable housing, because there are many different ways in which people can rent apartments or houses and it be more affordable. There may be private resources that a person brings to their finances, and you need to carefully establish any of these private resources, such as a special needs trust or an inheritance that is left to you in that sort of a trust. There's also ABLE accounts or individual development accounts. These are different ways in which you can put monies entrusted for the person who has a disability without jeopardizing their entitlement to Social Security benefits or other state or services that are available to a person with low income. It's important that you maintain your eligibility for Medicare in order to continue to receive these kinds of waivered supportive services. And so you need to be very careful. If a person is employed, which of course is another way of adding to their income source and being able to live a fuller life and pay all of their expenses. Employment also needs to meet the requirements of the Social Security Administration. If the person is able to be employed and gainfully employed, then Social Security Administration provides another ways in which you can gradually diminish your reliance upon Social Security benefits and sort of transition from being a Social Security recipient to being independently employed. So we suggest that you look at all these kinds of options for private resources. And again, if the person is not gainfully employed and unable to support themselves, you need to be very careful to watch their resources and maintain their access and eligibility to Social Security and Medicaid benefits. If you were to look at a special needs trust or an ABLE or IDA account, any of these kinds of trust funds or savings that would be designated for a person with disability, we strongly advise you to do that with an attorney who specializes in special disability estate planning, or with a fiscal planner who also has this type of expertise. Because if it's not set up correctly, then the person loses their access to federal benefits and would possibly not have enough money to sustain their lifestyle. There are also rental subsidies available. So if a person were going to be renting a house, an apartment, or a condominium, it may be possible to apply and receive a housing assistance voucher. Now, these vouchers are wonderful, and so therefore there's a high demand for them and often waiting lists. But they're worth going and through the process and applying for. And in the guide, we have a whole page of resources of where you can get these, because unfortunately you do not go to one location and fill out one application. To access a housing assistance voucher or a rental subsidy, you may have to go to multiple places. They can be federal, state, county, local. They could be housing authorities that administer these. They could even be within an apartment complex where certain apartments are designated for receiving a subsidy. There's a lot of places to look. The wonderful part of a voucher is that the federal government would determine what the fair market rent would be. So FMR, or fair market rent, would determine the maximum amount of rent that you could pay in one of these subsidized apartments. And then with a voucher, the voucher says that the individual can only spend up to 30% of their income on rental. And the voucher supplements the difference. So for instance, if the rent were $900 per month, just as a good, easy number to work with, and the individual had $1,000 a month and of income, only 30% or $300 could go towards paying their rent. So $300 or 30% of their monthly income would go for the rent. And then the balance of the rent, so if the rent was $900, the individual would pay $300, then $600 would go from the voucher to pay for the rent, and that gets paid directly to the landlord. So you see, it makes living in the community independently as something viable, because the person would not be spending all of their Social Security check on rent. They'd only be spending 30% of their income. So we encourage you to look into these vouchers if the person looks to live in a house or apartment on their own or with roommates. You can do this also if you have roommates and can share the expenses. But the roommates would need to qualify as well. So these vouchers get reserved for people who are of low income. Sometimes there are set-asides that are only for people with disabilities. So when filling out an application for any of these vouchers, it would probably have some place to indicate whether you're disabled, and it would be to your advantage to indicate, if you have a disability, to indicate that on the application. You can be on multiple waiting lists for these housing vouchers. When your name comes up, however, you do have a short period of time where you have to move and find an apartment that will accept the voucher and put the voucher into operation. Otherwise, the voucher would go to someone else who's on the waiting list. Mainstream resources is a term that we have been using to talk about the kinds of generic benefits that are out there for anyone who has low income. Now, when the adult has Social Security as their income source, they're looked at for most of these mainstream resources as an independent person, and the family income may not come into play. So that's where things that are available to people of low income may also be available to people with disabilities who rely upon Social Security and some employment as their main source of income. Examples of mainstream resources would be some of the energy assistance programs, weatherization, SNAP, which was formerly known as food stamps. Sometimes there's telephone and communication devices that can be made available at no or low cost to people who are of low income. So you really need to research what you need and what might be available. New programs are happening all the time, so we encourage you to be active and be looking at those. Assuring quality is an ongoing requirement for someone with a disability and the people who advocate for him or her. Making sure that things are going well is very important. Families are so critical to this. So you need to be making sure that the person has a safe, decent place to live, that they're being well cared for, that their needs are being met, and if not, speaking up about that. There are many ways to do that. We also strongly advise that everyone in this field, become involved with an advocacy organization. See what's happening with the legislation. Let your elected officials know what kinds of things you need and what kinds of laws are important to you. Advocate when things are going to possibly be cut. We have made great strides in terms of advocacy on a major level here to guide policies, procedures, regulations, and funding. So we strongly encourage you to do that. What to do next? If you haven't done it already, definitely download a copy of the guide, and I will give you the website again where you can access that guide. We give you a list on the back cover of things that you can do and how you can gather information. Begin putting a plan together. Pull together a circle of the supportive people in your life. Who are the best advocates? Who are the people that are helpful and professionals, family members, relatives, neighbors, friends? These are good people to pull together, and then look at the person with a disability and listen to them. What does that person want? Where do they want to live? Who do they want to live with? What kinds of services are important to them? What makes them happy? How do you design those things into their lives? You want to make sure that you're applying to obtain eligibility for the services that are available. If you're looking for community care waiver services, which are very comprehensive, intensive kinds of services, there may be a waiting list. In New Jersey, there is a waiting list. And so you, as a parent of a child with a disability, you may be able to get onto that priority waiting list if you're age 55 or older, or if there's intensive service needs for your family member at an early age. And so you want to get onto and advocate for yourself to get onto the waiting list for those services. While you're waiting for those types of intensive services, you may be able to access supportive services through the support program. And that's a fixed sum of money, again, as the up to budget number that you can plan for with your support coordinator to provide things that will help you to live more independently in the community. And be looking at housing options. Where does the person want to live? Did they grow up in a neighborhood where they already know family and friends and civic leaders and have resources available to them? That may be a place where they want to continue to live. Are they in the wrong setting and they want to move to a different type of setting? Maybe they're in an urban setting and want to live in more suburban, or vice versa. These are the kinds of things to discuss and to decide. What are the supports that they need to live more independently? And don't forget to rely upon assistive technology to the fullest extent possible. And rely upon friends and neighbors, community members, church members, if you are part of a worship group or a religious spiritual group that may be able to help you. Develop contingency plans, because things don't always work the way you plan them to be, or emergencies can occur that you didn't plan on. And so what's your backup? If you had to do something on a very short-term basis, on a very immediate basis, what would that be? And how would the person with a disability be cared for? If there were an emergency, you would then also, where a caregiver could no longer take care of the person with a disability, you would need to advocate very strongly with the state agency in New Jersey, that being the New Jersey Division of Developmental Disabilities, and contact them and let them know of the urgency of your circumstance, because they may be able to move much more quickly than what would naturally happen as part of being on the waiting list. So I'd be happy to take questions. Just to recap, I've talked about some housing models that have very innovative elements, and of that, we're looking for people to live integrated lives, be as independent as possible, share their home, and live with people they want to live with or live alone if that's what they prefer, that their housing really be planned for and designed in a very custom, individualized way. And then resources from government sources such as Social Security Administration, waiver services through the Division of Developmental Disabilities, whatever employment or other kinds of private resources that might be available get utilized very carefully into a budget so that the person can live as independently as they possibly can. And with that, we encourage you to seek out things that are available in the generic population of people of low income, such as housing vouchers, SNAP, food stamps, and energy assistance. Are there any questions? Elena, do you?
Hi, Deb. I was just typing in to let the group know that if there were any questions that they can type them and I can read them aloud and then you can answer them. So I'm not sure if anybody has any.
And this is the website where you can download the housing guide. And you can also call Autism New Jersey if you'd like to receive a hard copy of this.
Yes, you can call our number. Go ahead.
Did you want to give that number, Elena?
Oh, sure. It's 800-4-AUTISM.
And we will be posting this webinar on the Shaw Supportive Housing Association of New Jersey and the Autism New Jersey's websites so that people can listen to this again. The Housing Guide provides a lot of information. There's a wealth of information, and you may need to look at it sections at a time because you don't need everything all at once. First step, you would be trying to decide which model or which elements of those models would be best suited, and then you need to look at how it would be funded. Those are kind of some of the first steps, also making sure that you're eligible for those Social Security benefits and eligible for New Jersey Division of Developmental Disabilities. And I did not mention that if you have a child under the age of 21, in New Jersey, those services would be accessed through the New Jersey Department of Children and Families. And they would be able to provide some services like respite and camping and therapeutic services and things of that sort for children. The transition time would be at the teenage ages between 16, 18, and 21, where a person would convert from the Department of Children and Families to the Division of Developmental Disabilities. It's a journey, and we use that as the theme here because there's ups and downs, there's roadblocks, there's detours. It's not always a smooth, easy path. The services that a person with developmental disabilities may need could be very costly and expensive. And so therefore, a lot of people who have those needs utilize the resources, and there are never enough resources available. So we've tried to map this out for you in steps and in understandable terms to make the journey more comfortable and easier for you. And the Supportive Housing Association of New Jersey has a lot of information on their website as well, and we'd be happy to assist in any way we could to help people to get the information they need to access these services. So we wish you all the best on your journey.
Thank you, Deb. And I would just also like to mention to the group that if anyone is looking for information for children who are transition age, we have our transition conference coming up next February, and you can find information on our website about that, as well as a guide to transition in our publication section. And that can also be downloaded, or you can request a copy. And we can also help families with their questions about utilizing the children's system of care and applying for eligibility for children with developmental disabilities, or any questions that result from that. And actually, it looks like We just got a couple of questions coming in, so I'm going to read them to you, and let me just see if I can expand this because I'm having a little trouble seeing the entire question. Let me see. Okay, so the one question is, how long should a parent wait for DDD to respond to, looks like an emergency, if I have that right? Oh, an emergent CCW request?
How long should you wait? Well, sometimes people's safety may be in jeopardy if they don't have some kind of a response quickly. So it's really an individual decision of how long can you wait. You need to be very assertive, and I recommend in dealing with state agencies that you put things in writing and keep your own records so that you have evidence of your in documentation that you've made these inquiries and that you've made these requests. It can be very frustrating when you have an emergency situation because government bureaucracies can sometimes take a long time. I just, again, encourage you to be polite but assertive and to speak up and be persistent to seek the services that you need. I also should mention, while we're getting the next question ready, that when we talked about housing vouchers, I did not mention and should have that right now the New Jersey Division of Developmental Disabilities is helping people who are on the supports program with funding towards what they have as rental assistance. They've designed their own program for rental assistance that is very similar to the federal program, and it allows people on a transition period of time to receive a voucher while they're accessing some of the federal or state vouchers that may be available. So when looking at the supports program, or even in the community care waiver, the Division of Developmental Disabilities may be able to provide a voucher that could help with rental assistance.
Okay, and it looks like the last question was if there is an appeal process if someone is denied, and I'm guessing that means DDD eligibility?
There is an appeal process for the Division of Developmental Disabilities. If you apply for eligibility and are denied, we encourage you to appeal. You may even want to seek some legal advice or professional advice on that process. We encourage you to read and learn as much as you can when you're making application of what the eligibility criteria is, so that you may be able to provide documentation or records or information that could help them to make the correct decision. Also with the Social Security Administration, there's an appeal process as well. And you can, if you are denied access to Social Security benefits, you can follow that process.
Okay, thank you. And it looks like that is the end of our questions. I believe I went through them all. Yes. So if we don't have any more, we can always wrap up and offer everyone to follow up with you or to follow up with Autism New Jersey and with SHA. And thank you so much to everyone for attending, and we hope that it was helpful to you. And thank you, Deb, for your time.
My pleasure.
And expertise. Okay. Thank you.